What's the best thing you've seen as a doctor? This is part one of the series, and I like to think of this as the sort of Lion King circle of life. I was working a night shift in a rural hospital, and I was asked to see a patient who was on what we call the end of life pathway. They had a terminal disease and they were in the last few days of their life. And it's during this time that we focus less on trying to reverse the disease. We talk about quality of life more. Now, that should be the focus at all times, in my opinion. We should always be thinking about quality of life rather than quantity. But it becomes a lot more apparent when you're in your final few days. I go into this patient's room. Their son is in the chair next to them. It's about 11 o'clock at night. Their breathing's getting more laboured and they're getting a little bit agitated. I talk to her and her son about adding some medications that can make her feel more comfortable. Medications like morphine, which is a strong pain relief, and midazolam, which can calm down anxiety, and it can also manage that sense of restlessness. We start these medications, the patient looks and feels more settled and comfortable. Later on in the evening, about 2 or 3 hours later, I'm called back by the nurses to let me know that this patient's died. And instinctively that feels like a failure, but actually, especially after the conversation I'd had with her son, this was a good situation. They were comfortable, they were with a loved one, they didn't have any pain, and I think this is how I'd want to die. Well, I go over and the son's still there. We have a lovely chat and I even gave him a hug. And then I go back to the emergency department where I'm stationed and working. About 45 minutes later, I get a phone call from the maternity ward saying that a patient is in labour. They've called in the obstetrician, but can I assist? I rush over to the maternity ward where I assist the obstetrician. My role as the sort of assistant is pretty minimal. I'm there to put in a cannula if I need to sort of pass instruments or anything like that. Now, I've assisted with deliveries about 20 times, which isn't much. You'd think that at some point it might get boring. I guess if you talk to my obstetric colleagues, maybe it does. But I tell you, hearing a baby's first sort of cry and seeing the joy in the parent's face is second to none. And I'm trying to act professional as if I don't really care, but it is pure joy. And this is awesome. I have been able to be part of the end of someone's life, making sure that they don't suffer and they have a dignified, lovely death. And then the start of someone's life and the joy that their parents have too. How lucky I am to be in this job.